Hello everyone, I am Dr. Rachna Shanbag Moite, a pediatric immunologist and rheumatologist, and in today's video let us discuss about very early onset inflammatory bowel disease. I'm sure you have heard about inflammatory bowel disease developing in adults, also known as Crohn's disease and ulcerative colitis. However, when children below the age of 17 years develop features of IBD, we call them as pediatric onset IBD. And a subset of these children, when develop symptoms before the age of 6 years, we label them as very early onset inflammatory bowel disease. Accounts for 17% of pediatric onset inflammatory bowel disease with a prevalence of 14 cases per 1 lakh children. Why is it important to know about VEO-IBD? This is because it can be the first or one of the manifestations of primary immunodeficiency diseases. These children present with recurrent episodes of diarrhea, abdominal pain, vomiting, failure to thrive, and characteristically have presence of perirectal disease in the form of fistula, fissures, and even perianal abscesses. The associated features might also give a clue to the underlying PID, recurrent or atypical infections, autoimmune disorders, HLH, dysmorphism, albinism, or atypical skin and hair manifestations. So how do we evaluate these patients? Apart from CRP and ESR, which are often found to be elevated, fecal calprotectin levels are markedly elevated in all these patients. To establish a diagnosis, all patients need to undergo endoscopy and biopsy shows histological features suggestive of inflammatory bowel onset IBD being a monogenic disease. All patients must undergo a genetic test to establish the diagnosis. Most patients fail to respond to conventional therapies, hence establishing the underlying monogenic disease can help in offering these patients more targeted treatment.